question for you, as Senator, how do you view universal health care and health care as a human right? And what steps would you take to ensure affordable care for all Americans? And what do you think about Medicare for all?
Well, I'm a co-sponsor. I've been a co-sponsor of Medicare for All since I got to Congress. Just so y'all know, we didn't sign up because we was running. Right? You can look back. In fact, Pramila Jayapal, her leadership pack is Medicare for All. So even before I got there, we had a conversation and she asked me where I stood and I told her. There are those that are arguing that in a state like Texas, you're not going to be able to run and win the general, and if you stand for things like Medicare for all. I disagree. Right? I think that if there's any moment where people are like, you know what, I will take whatever policy will give me something, it is this moment. Because we already know that in Texas we lead in uninsured in the country with over 5 million uninsured. We also know that while we don't lead as it relates to those that need to use the marketplace, we are one of the leading states that needs to use the marketplace, and we know that those tax subsidies that ended up expiring, because anyway, y'all know what happens. And so, the only good news I had this week, because this week was a really, 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 really tough week. For so many reasons in DC. It was very emotionally draining. But the good news was we finally had a bright spot. So first one in a long time. And that was that the discharge petition. Yes. Yes. Everybody really knows that. All right. I'm not sure everybody knows, but there was a 3-year tax subsidy extension for the Affordable Care Act. The Democrats led in the minority. And we even got to show some love to Marge, because I think Marge may have signed off before she left. But nevertheless, we got it to the floor, and a number of Republicans crossed over. Now the question is, what will happen on the Senate side? Who knows? And again, the Senate actually had an opportunity before the end of the year, and they failed us. So we will see what happens now that the House is going to send that over. So long story short, I don't think that people should have to choose between food and healthcare, choose between housing and healthcare. I think that it is a basic right. And so the idea that, literally, when we were in the shutdown, and then I'll shut up because I know she's gonna be like, they should have told me. But when we were in the shutdown, there was a woman that sent me an email, and I don't read all my emails, y'all, but I do read them when I can, right? So I got staff that reads them all. But this woman sent this email, and she said, Ms. Crockett, please hold the line. And I'm thinking to myself, now girl, you ain't got it. I am never the problem with holding the line. Ever. So I'm like, so I'm reading, and she tells me that she's a furloughed federal worker, but she's saying hold the line. She said that she has cancer, and she's saying that if these tax subsidies, or overall just the healthcare costs going through the roof, because y'all gotta understand, healthcare in general is we're all paying into a big pot, and then they're like kind of gambling on who has to pull down from the pot. And overall, the less that we have going into the pot, so when the subsidies expire, and some people say, well, I just can't afford the health insurance, that's less people paying into the pot, which means that everybody else who's in the pot gotta pay more. And one of the reasons that so there's a combination of things that happened. The big ugly bill was actually the first trigger. They took $1 trillion out of healthcare when it comes down to Medicaid and Medicare. So when they pull that out, we've got hospitals that are going to shutter. We've got these places that we all pay into. So now when the hospital does their budget, and they're normally saying, well, we can estimate we're gonna get X amount of dollars from Medicaid or Medicare, it doesn't just reappear magically now that you took somebody off. And so what's happened is the cost of care has gone up, and the cost of insurance has gone up. And then they decided to kick people while they were down by getting rid of the tax subsidies as it relates. So like our healthcare stuff is all jacked up. And they want to say we can't have Medicare for all because they say it's too expensive. But the reality is that if some people would just pay their fair share on their taxes, then we could. This is going to boil down to priorities. This is where the people have to speak up. If you can find a random $40 billion laying around to send to Argentina, then you can find the money. You can find the money for the things that you want to find it for. If you can find the money to go and invade Venezuela, all right? And they ain't even talked about, listen, now, I'm not supposed to tell y'all what happens in these briefings. So I can tell you is that I still don't know the answer to this question. So that means it didn't come out of this briefing. I still don't know how much it has cost for us to even actually go in and do what we did. That stuff is expensive. I want y'all to understand that. And nobody wants to talk about them dropping bombs in Nigeria. All this is really expensive, y'all. I'm telling y'all. So I'm just like, listen, maybe if you hold on to the bombs, okay? And let me just put it this way, and then I'm gonna get on because she's gonna kick me out and never invite me back. Tupac had a song. He used to say, we got money for war, but we can't feed the poor.